Okay. Good morning. My name is Elizabeth Leone, and I'm the chairperson of the New York City Local Early Intervention Coordinating Council. I'd like to welcome you all to our web-based LEICC meeting. New York City's local law number 103 and the New York State Open Meetings Law requires open meetings to be both webcast and archived. This meeting is being recorded today. I'll now review the procedures for the LEICC meetings. For in-person LEICC meetings, attendees should pre-register on the New York City Department of Health Early Intervention LEICC webpage. For web-based LEICC meetings, attendees will find a link on the New York City Department of Health Early Intervention LEICC webpage. Meetings are open to the public, but the audience does not address the LEICC members during the meeting. For this web-based meeting, we will not be using the chat or Q&A features. For this web-based LEICC meeting, members of the public were asked to submit written public comments by emailing embeddedcoaching@health.nyc.gov. Public comments will be read into the record at the end of the meeting. LEICC members will raise their hands instead of raising their cards to make comments. LEICC members should keep their cameras on during this meeting. Transcription is available for this meeting. Written meeting minutes will also be made available. We will have the LEICC members introduce themselves, and we will start with our Assistant Commissioner.
Hi, good morning, everyone. My name is Lydia Ledniak. I am the Assistant Commissioner for the New York City Department of Health Bureau of Early Intervention, and I'll turn it over to Renee to introduce herself.
Hi, good morning, everyone. I'm Renee Noel. I am the Assistant Commissioner for the Bureau of Child Care within the Department of Health and Mental Hygiene. Thank you.
Chris?
Hi, good morning, everyone. Chris Tan, Assistant Commissioner for Education Initiatives at ACS. Patricia?
Good morning, everyone. I am Pat Gray, and I am part of the academic partnership at Hunter. Thank you. I can't see everyone's name, Lydia. Could you help me with calling on the next person?
Sure, happy. Liz?
Me?
Yeah.
Oh. Hi, my name is Elizabeth Leone, and I am an educational director at Brewer College's Early Childhood Center. And I'll pass it to Michael.
I'm sorry, were you introducing me, Patricia?
Yes.
Oh, okay. I'm Michael Bergen. I'm Director of the Speech Language Hearing Center at Brooklyn College.
Great. Mary, would you introduce yourself?
Hi, everybody. I'm Mary McCord. I'm a general pediatrician, the director of pediatrics at Gotham, and the clinical lead for our early childhood advanced primary care project called 321 Impact.
Great. And I think Dr. Periasamy is next.
Yes, hi, good morning, everyone. Happy Friday. Sundari Periasamy. I'm the general pediatrician, just like Dr. McCord, and I am the pediatric residency program director at Harlem Hospital, as well as the associate director of the department. Thank you for having me today.
Great. Okay, I believe that's everyone.
All right. Okay, so now we will approve the minutes from the last LEICC meeting. Will someone make a motion to approve the minutes?
Approved.
Thank you. Will someone second the motion to approve the minutes?
I second the motion.
Thank you. Now please raise your hand to approve the minutes.
Okay. 2, 3,
Right.
5, 6, 7. Okay, motion to approve the minutes carries. Thank you very much, Liz.
Okay, thank you. Now we will move on to our next agenda item. So now we will have Assistant Commissioner Lydia Lenyak present on the SEICC report.
Thank you. Okay, so the last State Early Intervention Coordinating Council occurred on September 14th, 2023. This was the agenda items that were covered in during the last State Early Intervention Coordinating Council. I am very pleased to say that the New York City EHR EI initiative, we had an opportunity to present that to the State Department of Health and to the State Early Intervention Coordinating Council on September 14th. We specifically, Mary, this might be of interest, we specifically talked about some of the challenges with consent as part of the rollout of the EHR EI initiative. I think the EICC was very receptive to thinking about, you know, what are some ways that we can make that the state can make consenting requirements a little bit more streamlined. So I was really happy about that. I remitted all of the SEICC materials, all of the presentations to the LEICC members so that you can review it at your leisure. Specifically, I'm going to focus a little bit on the State Early Intervention Coordinating Council administrative updates. So Commissioner McDonald, who is the new commissioner of the New York State Department of Health, was actually supposed to join the last SEICC meeting, but he sent a video message because he got pulled away last minute. We are really excited about having him be the New York State Health Commissioner. He's a pediatrician and was a practicing pediatrician for many years and very much appreciates and understands, you know, the importance of early intervention, which is actually kind of a first. You know, state health commissioners tend to have sort of a broader medical background. And so we're very excited about having a real advocate at the New York State Department of Health for this program. There was an update provided on county administrative contracts. We are very interested to see what our county administrative contracts are going to look like because it looks like there might be some modifications there. More on that as we have it. There was an update on covered lives, or rather a lack of an update. So the State Department of Health reported that there has not been any additional release of funds to the City of New York or other municipalities for the covered lives assessment. And we in New York City are growing extremely concerned about this. And, you know, because when the covered lives legislation was passed, the New York State Department of Health stopped billing private insurance for EI services as of January 1st, 2022. However, because the covered lives funding have not been coming in to offset that loss, municipalities are losing money, unfortunately. And in this economic climate, that really has an impact on the programming that we're able to put forward. And we, you know, obviously the city is very committed to this program, but we are broadly concerned because not only have funds not been released for 2022 or 2023, there has not been any disbursement schedule established through 2027. So we are growing quite concerned about this issue. There was an update on neonatal abstinence syndrome, NAS. I put the ICD-10 code for you there. As of September, it is now going to become an auto-eligible condition for the early intervention program. There was some advocacy that happened around this due to the impact that opioid use has been having, you know, on the New York State population. And so we are going to be starting to work with our partners to ensure that everybody is aware of this modification. This is a positive development because before technically this was kind of a at-risk condition. So this is a positive development for us here in the city. State Department of Health also indicated that they were interested in thinking about billable and non-billable service coordination units. For those of you who are familiar with service coordination practice in New York City and New York State, a service coordinator is like a case manager. However, not everything that a service coordinator does is billable, is a billable activity. And we estimate about 50% of what service coordinators do is in fact not billable. And so the State Department of Health, in the face of now a growing service coordinator shortage, is starting to look at billable and non-billable units and considering what non-billable activities can now become billable, which is a really positive development as well. The early intervention revised rulemaking, the State Department of Health completed the first round of comments. Many comments were received with regard to the new rulemaking. And at this SEICC, the State Department of Health announced that the regulations would be republished due to substantive changes. And that in fact has happened. Early intervention revised rulemaking was released on October 11th. Actually, just a few days ago. We are currently looking at that revised rulemaking. I encourage interested parties to do the same. There were some improvements in this round of rulemaking, particularly with regard to group developmental interventions. And so we were very happy to see that. We will be taking a more thorough look at this revised rulemaking and determining if New York City will make comments again. The state, as a final item, the State Early Intervention Coordinating Council, the director of the Bureau of Early Intervention announced that the telehealth guidance document was almost in its final, was almost approved. And we are hoping that we will see a New York State early intervention telehealth guidance document before the end of this year. At least I'm hopeful that will happen. Okay, any questions on any of the items that I brought up from LEICC members? Okay, let us move on.
Okay. So now we'll have Nora Puffett, Director of Administration and Data Management, presenting on the data report, provider oversight activities, and the EI Hub update.
Morning. So starting out with the data report, we're looking at referrals here, and I just want to draw your attention to this time frame. So FY19 started actually in July of 2018, and we're running through FY23. And so at this point, this is giving us sort of a nice picture of where were we right before COVID, what happened during COVID, and where have we been going since. What you can see is that from 20 to 21 and 21 to 22, we had kind of a nice steady increase in the total number of referrals. And we're much closer now to FY19. But then we had this small drop off this year. And I think what happened is that a lot of referrals that happened in FY22 or FY22 would have happened in FY21, but parents held off or referral sources held off because they had continued COVID concerns. And so we think we're just sort of leveling off and getting back to probably where we should be, keeping in mind that it looks like we're going to have a continued smaller 0 to 3 population in New York City. Right now, those numbers look like they're going to keep going down. So we'll see our absolute numbers drop a bit. Next slide. This is by race and ethnicity. And as you know, our focus has really been on getting the number of Black children participating in early intervention to get those numbers up. And I think we really made some progress there. And what's amazing about that is that we made progress even during COVID. If you look at that, I mean, in 2020, it actually went up slightly from 17 to 18% of all referrals. So that's really exciting. And I think a credit to the outreach work we've been doing. Next slide. So this is services, and what I want to remind you here is that some of these children will have been referred in the previous year. And as a result, services tends to trail behind referrals just a little bit. And you can see the difference. From 21 to 22 to 23, we had a consistent increase. And it's very possible that this year, 24, we'll see that slight drop that mirrors the drop we saw in referrals last year. Next slide. And in terms of the racial distribution, also looking really good on that front. We've gone from 15% to 18% of children receiving services are Black children, which is terrific. Next slide. The aging out slide, as a reminder, this says of all the children who turned 3 in that year, how far had they gotten in the EI process? And this is looking very interesting. We're seeing some changes in the absolute numbers, but we're seeing, particularly with Black and Asian children, we're actually seeing an increase in the percentage of children referred who receive services. So that's great. Next slide. And this is insurance status. It's here for 2 reasons. To remind you, we are, many of our families are Medicaid-only coverage, but also in terms of the discussion of covered lives, we're seeing an increase in the percentage of children who have no insurance recorded. Even though we're not billing insurance now, we want that information because we'll need to revisit covered lives and we will not be able to negotiate if we don't know how many of our children actually have private insurance. So I'm going to stop there and just ask if there are any questions about the data report. Okay, so moving on to another hat, provider oversight, talking about the annual monitoring by service area to date. I'm just going to go straight to the point of, we're just seeing this so consistently and it's so concerning. The level of non-compliance with core ISC and OSC activity is astounding. As you know, we've really tried to focus on providing support in this area with our SC Professional Development Institute. And moving forward, we're really going to start mandating that agencies that fail in this area, they need to have their SCs take those trainings because this is a huge concern and it's only going to grow as the mentioned earlier, if we've got an SC shortage, the ability to provide quality SC when your caseloads are larger and there's less oversight is really, really a huge concern. As you can see, as always in services, we've got kind of the most stable representation across the spectrum and really very few failures, which is nice to see. Next slide. So something new we're doing in provider oversight is monitoring groups. So there are 23 center-based groups in New York City, and we've never really looked at them specifically for the qualities of a group, but we're going to start doing that in 2024. We're going to be looking at 7 standards related to staff qualifications, which has become a real concern in the last couple of years across EI programs, ratios and staffing plans, which includes everything from one-to-one aides to do you have a plan if the teacher calls out sick that day? Classroom settings and safety, which is both the physical environment and things like, do you have a policy for reporting incidents? And then parent involvement and communication, which I think is going to be really interesting, which is where we say, how does the parent know what's happening in the classroom? And how does the parent share with the teacher what they're seeing at home? So we're going to be using 3 sources of information. One is a review of policies and procedures, staff files, and the like. One will be a one-day on-site observation of groups. And one will be a survey of a sample of parents to hear about that parent involvement and communication. There'll be a final report to the agency. It will not have a rating or a score, but it will cover each of the 7 standards and how they did. Okay, next slide. And then switching again, I'm on the EI Hub. So we still do not have an implementation date, but SDOH has continued to promise that they will give us 2 months notice whenever that date comes out. So we're really waiting for that date for the moment when all of us are going to really need to make a concerted effort and focus a lot of time and energy on getting ready for the hub. Now, several New York City providers have done data use agreements with the state so that they could do role migration testing. And that's really important because Unlike NICE, the hub is going to migrate most of the data from NICE. And so we want to be sure that when users go in, they can actually see their own cases and their own documents in a way that will work, because we don't want you to go in and find that, those children are sort of locked to you. So that's gone well. And SDOH has also indicated an intention to conduct user acceptance testing with those providers and with us in New York City this fall. And that's usually the last step in a development and rollout process. So I'm guessing that when we get to the end of that, we'll have a pretty good idea of how soon we're looking at the hub coming on. Are there any questions about the hub? Okay, thank you.
Thank you, Nora. Now we will have Jessica Wallenstein, Senior Executive Director on the Committees on Special Education for the New York City Public Schools, presenting on committees on preschool special education updates.
Thanks, Elizabeth. Can you hear me?
Yes, yes.
Wonderful. Thanks for having me, Lydia, and everybody. Great to be back here. All right, you can go to the first slide. So I'm going to share some updates for the coming school year. I'm going to start by talking about the New York City Public Schools overall vision and where the CPSEs fit in with that vision. I'll share some information looking back at the past school year, and then I'll talk about our goals for the current school year and share some updates. So some of you might be familiar with this. This is Chancellor Banks' pillars for improving schooling for all youngsters. And they are reimagining the student experience, scaling and sustaining and restoring what works. So really looking at promising programs and spreading them across the city. Prioritizing wellness, and it's linked to student success, especially as we think about welcoming students who are seeking asylum here in the city, and then engaging families to be true partners. And where the committees on preschool special education sit within the special ed office, within the Division of Teaching and Learning, we really are focusing on reimagining the student experience, so that first pillar. And our Deputy Chancellor, Carolyn Quintana, is focusing on these 3 levers for change. So the first is that schools will facilitate mastery of core academic skills and content expertise. And I'm sure you all are aware that a real focus this year is on literacy for all and ensuring that our young students are having access to phonics instruction and all they need to move forward in their reading and writing skills. Lever number 2 is schools will facilitate pedagogy that prioritizes critical thinking and problem solving skills. And then level number 3 is that schools will facilitate a sense of belonging and inclusivity for all learners. So this is very schools focused, but as I work with our committees on preschool special education, we talk a lot about what does this mean for us. So we can go to the next slide. And this is actually a slide that was part of our internal kickoff for all 150 and change CPSE administrators and community coordinators, where we discussed where do CPSEs fit into this broader vision for change in terms of strengthening instruction. Well, CPSEs are often the very first New York City public school employees that families meet when they enter our system. And so they are critical to establishing trust between families and our school system as they are navigating, some very, very challenging entrenched bureaucracies. We also talk a lot about how a sense of belonging and inclusion for both students and families begin with the CPSEs, right? At that very first initial contact, and certainly in that first IEP meeting, this is where families can feel included in the process, and they can be set up understanding how their student with a disability will belong in a school community. And then the actual IEPs are what set students up for being able to access that core instruction in that first lever and critical thinking. And then, of course, CPSEs are doing so much work, and I'll talk more about this, in ensuring that our students with disabilities are welcomed into inclusive learning environments where they have opportunities to learn alongside their typically developing peers to the greatest extent possible. Okay, next slide. So now I'm going to just take go over a bit of a summary around preschool special ed for the past school year. So we'll start with just a little bit of data. So this shows over the past 4 years, preschool initial referrals, sorry about the typo there in the heading, and preschool students with IEPs. So, pre-pandemic, we were about 23,400 preschool initials. We dropped significantly by about 4,000 students during the pandemic. And then we have seen an exponential rise. School year 21-22, we really saw an influx of referrals. And then this past school year, that continued, although not quite as steep of an increase. But we anticipate that we're going to keep going up incrementally from here, where we are now exceeding in terms of students referred pre-pandemic levels. And this is not surprising. We know that a lot of our 3-year-olds, they refrained from EI during the pandemic. And so we know that maybe even more students, as we are coming out of the pandemic, are referring to preschool special ed because they are in need of services not having gotten those EI supports in some cases. And then when we look at our students with IEPs, so the number, pre-pandemic for many years was always around 30,000. So this is 3 and 4-year-olds, so not just initial referrals. That dropped significantly by about 6,000 students during the pandemic, and then is rising. The rise is not as exponential as the referral rate. I think that is kind of the most jarring takeaway here. And I think you all know that we do face challenges in evaluator availability. We don't have enough MDE sites as we wish we did. But we are seeing an increase, and we are doing what we can, and I'll talk about that to increase access to evaluations. But we are now, getting close to that 30,000 number that was our norm before COVID of students, preschool students with IEPs. Okay, next slide. So looking back at some of our accomplishments from the past school year. So, we are pleased that referrals are reaching and exceeding pre-pandemic levels, so that students who were refraining from families that were refraining from participating in special ed are now coming back and getting the services that they need. I know that we are all aware of our challenge in terms of evaluator availability, but we did increase New York City public school evaluations significantly last year. We have preschool regional assessment teams, PRAC teams, who are DOE MDEs that work at each CSE. We have 21 of them across the city. And 2 years ago, they did 1,600. We almost doubled that number. And we did that by extending their hours. We found funding for per session activity where staff could stay later and do more evaluations. So while we need many more than that, we are happy that we were able to increase a bit there. Another area that we are so proud of is our work around the least restrictive environment, or LRE. Historically, we have had an incredibly high rate of preschool students with disabilities being served in separate, segregated settings. We were at about 40% 4 years ago of preschool students with IEPs in self-contained or special class settings. It's about 10,000 preschoolers every year being separated only with students with disabilities. We know some students with the most intensive needs need those small settings, but we know 40% was way out of line. We were under corrective action for it. The state and federal target is 18%. This past year, we brought it down to close to 30%, and that was a 2.5% decrease from the year prior. And so we're really proud of our CPSEs for doing that work around inclusion and with families to set students up with IEPs that can help them succeed in inclusive settings. On the flip side, we're also looking to increase the number of students that we're serving in special class in an integrated setting. These are our special class programs that serve students with disabilities and students without disabilities. It's like preschool ICT. And we increased those recommendations by 0.7%. And while these might seem small when you think about our 30,000 students with IEPs, it is really quite significant. We also increased our students recommended for only related services. That's what RS stands for. And then we also, another metric that we look at is our fill rate in our SCIS classes. So we have had more SCIS seats available than there were students to fill them for years. And so part of our push of increasing those recommendations is also, looking at, are we filling the seats that are out there, and then making a case for more seats as needed. So 2 years ago, we filled 64% of the SCIS seats. Last year, it jumped up to 81%. And I actually was just looking at the numbers so far for this year. In October, we're already at 74% for this year. So we're on track to get towards our target of filling all of those SCIS seats this year. When we're talking about LRE, we also look at a lot of our disproportionality by race and gender. I think it's well known that in preschool, boys are disproportionately represented in special education. 65% of preschool students with IEPs are male, 35% are female. But we are starting to see, some of those inequities change a little, and particularly when we cross them with race. So just looking at boys, the rate of boys recommended to special class was 35% 2 years ago. It dropped down to 33 and then 30% last year. And then when we look at Black boys recommended to special class, that was at a whopping 47%. So 40%, 47% of all Black students who are male were getting recommended for self-contained settings 3 years ago. This past year, we brought it down to 40%. Not where we want to be, but obviously some significant improvement. And then Hispanic and Latinx boys, it's very similar. They were at 46% 3 years ago, and we dropped that down to 36% in this past school year. So more work to do, but we are, making progress there in addressing some of that disproportionality across the city. Okay, next slide. So I want to talk a little bit about the upcoming year. So as far as our goals for this year, what we really focused on in our kickoff with all CPSE staff and what we're doing a lot of training around this year is around family engagement and support. So every CPSE administrator knows that our focus is in ensuring all families understand the CPSE process, are heard and supported in IEP meetings, and experience consistency across the city in our practices and processes. We have always, had this as a goal. I would say this is the first year where it is explicit and it is, transparent to every single one of our committees on preschool special education. And then, of course, we are continuing the work that we began when we first got our state corrective action a number of years ago around LRE, where we are still working to decrease special class recommendations so we can get closer to the federal and state target of 18%. And concurrently increase our SCIS recommendations. And then we're also starting to take a look at our CIT and our related service recommendations to make sure that we are also looking to see if students can experience any movement towards LRE in terms of going from individual to group, or the intensity of sessions in a week. So we're also doing a lot of training with our CPSEs to ensure that those recommendations are in line with students' present levels of performance. Okay, next slide. So I think this is my last slide, just some updates for all of you. Something that we are excited to share is that we have an updated evaluation list for families. I know historically there has been, this huge PDF that was very stagnant, no way to kind of sort through it, and families would call agencies and the numbers wouldn't be working, and they wouldn't have the availability that the list indicated. So being aware of all of those problems, we went ahead and surveyed all of the state-approved evaluators and got updated contact information and language availability and put them into what we think is a more family-friendly list that is live online, so families can kind of sort and look through it and get more up-to-date information. I'm sure it's not perfect. I know there are some numbers that probably need to be updated since we last surveyed the field, but we are going to be doing this quarterly and we'll update it in real time on that live list. For families who are not, consenting to electronic communication when it comes to getting the CPSE packet, we print out the list and snail mail it to those families. Also, as I mentioned before, we were able to double the number of evaluations done by DOE evaluators, our PRAC teams. We're still waiting for final confirmation on funding, but hopefully we will get that, and we hope to repeat our per session activity so that, again, PRAC can offer extended hours. Also, another difference this year is we changed our timing and our approach to transmitting for related services for preschool. Normally, we begin that in September. This year, we took a stab at trying that in August so that we can increase coverage for the first day of schools, particularly for students in, community-based organization preschool settings and those who are not in necessarily district school settings where they would be served by district school providers. So we are seeing already some improvements this year over last year when it comes to related service coverage for students across different preschool settings. And then finally, an exciting announcement. We are creating an 11th CSE. To date, our Brooklyn South and our Staten Island CSE 7 has been, amazingly supporting more students than any other CSE in the city by a long shot. So to better support the students and families in both of those regions, we are separating out our Staten Island office to be its own standalone CSE. It's CSE 11. The chairperson of that CSE started this week officially, and we are looking to hire up the rest of the leadership team. Although the remaining staff is staying the same, families will experience no disruption. It's just going to be major. The major change is in communications and nomenclature, and then of course the families in both offices getting more dedicated support, having their own leadership teams. So changes to the website coming, changes to inboxes coming soon. We are just launching, and it'll be a transitional period over the next few months. All right, so I'll pause there and see if anyone has any questions.
I just want to say thank you for this. I think this is the first time at the LEICC when we had such a amazing and transparent presentation by our next system over, where many of early intervention children end up. And so I think I'm really appreciative. I'm sure the other LEICC members are also appreciative. I'm going to ask if any of the LEICC members have any questions. And I see some of the audience members are giving you a big thumbs up also. So thank you, Jessica, for that presentation.
Thank you.
Thank you, Jessica. And I want to say too, as a parent, I know for me, it was a culture shock coming from EI to CPSE. And so I'm appreciative of you almost, trying to align yourselves with some of the culture of EI so that it feels like a smooth, transition for parents. So thank you for that.
Thank you so much, Elizabeth.
No problem. Okay, so now we'll have Renee Noel, Assistant Commissioner of the Bureau of Child Care, reporting on the Bureau of Child Care update.
Okay, hi, good morning again, everyone. I'm going to share my screen. Hopefully it will work. Wait 1 second. I'm going to share with you now just a brief overview or review of our childcare background clearance online form. You all can see my screen, correct?
Yes, we can see it.
Okay, wonderful. So yes, we launched our online form May 22nd of this year. So we're approaching about 5 months in, and happy to report that it's been going really well. The goal really was to streamline the process, make it more simple and understandable, more intuitive for applicants, both the applicant and on our end when we're processing the applications. So we've done webinars to provide information to the providers, childcare providers, as well as sending emails and blast emails and just being able to provide as much information as possible. We have our website here, which you are seeing. We also, okay, so I'll just go into this. So this is our, and oh, I wanted a disclaimer to just mention that this is mainly for group childcare center-based programs, as well as school-based childcare. If it's state regulated programs, that's a different system, and they are also online, but you would have to go to the OCFS webpage where they have their system as well. So here is our main childcare website, and operators are to go to the information for childcare operators page. And here it is a list of all that's needed. It provides you with the distinction of a group childcare only or a school-based. So what we've noticed since the launch, there have been people submitting to the wrong link, right? So it's important that people understand what modality that they are a part of, and they click on the appropriate link. So if we go into group child care center based, again, it will break down all that is required, what's needed. We provide a checklist which tells you what you would need before you sit down to this online form. We also have the instructions for the applicant. We have the SER form, which is the LDSS form, which was always used in the past. So it's just there for your convenience. You fill that out, you still process it on your end with your resource code. Everything that you did prior to this online form, you would continue to do. So the SER still needs to be processed on your end. And what we're finding is that folks are not doing that, so we've since the launch, we've come up with tips and better ways for people to submit a healthy form, so that the process is even faster. We have an authorization affirmation form that needs to be completed. It's just detailing what we are looking for, what we will be checking in terms of the background. We're doing the criminal background, which is the fingerprints. We're doing the SER, which is the sex offender, child abuse, maltreatment system, as well as the SOR, which is the sex offender registry. We're also checking SEL. So it's a whole host of checks that we are looking at. Also a worksheet for, so this system is, flexible. So the applicant can be the one sitting down to the computer and submitting the form on their own behalf, or some programs have an HR department, or maybe the educational director is the one that's submitting the application on behalf of a new employee. So the worksheet is for that person who needs to get all of the details, the date of birth, all of those information from the applicant, from the new employee, and then they themselves would sit down to the computer and enter all of that information. So if you're not the actual person, the applicant that's submitting the information, this worksheet is for you so that you can gather all of the information before you sit down. Then also there's the frequently asked questions document. So all of that document has all of the questions we anticipate programs would have, applicants would have. And so hopefully it helps with the process and making the application easier to complete. So this is the online form that programs are to submit on behalf of their staff, right? We are then processing it. We're getting all of that information and then sending it out to the various other entities. So FBI, right? We're sending it, we're trying to get the results from the Department of Investigations. We are sending it out to the SCR. Well, the program is, right? And we're receiving the receipt as well as the LDSS form. Then we are awaiting the results of that. So we will access that database, the SCR database, to get the results. That processing of the SCR may take some time. So it's not really on us, right? So we're waiting as well for that information to come back to us in order for us to complete the whole comprehensive background process. The SOR, everything is like, when you're outsourced, we're outsourcing, and we are just the individuals that are gathering all of the results in order to provide the applicant with an eligibility letter, or or denial, something that is letting them know what the result of their background check was. So that process has been great. We've received a lot of feedback from programs indicating that this form is definitely simpler. You receive, I can click on this. This is the background. This is the actual form that individuals will go into. They would enter if it's a new staff, existing staff, and they will enter all of the information. So it's two parts. It's the program information. You would need to know the DCID number, and that's basically it. once the DCID number is entered, it automatically auto-populates the information because it's connected to our internal database. And then there's the applicant information that we would also enter. It tells you what you would need in order to, like, you wouldn't even be able to go further or submit the application if you did not upload these 3 documents, right? And you would have to affirm and all of that. And then you receive, once it's submitted, you receive an email confirmation with all of your, confirmation number. So we call it a BLA number. So you would have that BLA number and you're able to use that BLA number in the future to make, to use the lookup tool. Are you still seeing my screen where it says application status check? So
Yes.
if you have, right. So if you have a BLA number, you can enter it here and then click on search, and it would tell you the application is submitted and will be reviewed. So that is the initial, once you've submitted, this is what you would probably see. Now, if it's like completed or you've received an approval, you can enter, when you enter your BLA number, it would give you this message that the department has completed its review of your application and you will receive an email shortly. So that email will have an actual PDF letter, which is letting you know that you've been approved, and you can keep that for your records. So when we come out to do inspections, we know that you've been cleared and you're eligible to work in a childcare setting. I think
Great.
that is it. Right.
So thank you. Thank you for that. It is greatly appreciated. Certainly the application process, moving from manual to an automated process is amazing. One of the biggest questions that I have heard from providers is if they submitted a paper application,
yes,
and now the new electronic system has launched, what should they do in terms of the outstanding application that they have? Should they resubmit it in the electronic system? Should they wait? Can you just sort of, I think many people are interested in that information.
Sure, definitely. So last week, I believe last week we sent out an e-blast about paper applications. We are no longer processing paper applications. And what the email states is that if you submitted a paper application prior to May 14th, because May 14th, we stopped receiving the email or manual applications in anticipation of the launch on the 22nd. So if you had submitted paper applications prior to that date and had not received a result of anything yet, you should resubmit in the online form, and it would be processed faster, in that case, because we're no longer doing the paper application. We realized that it was bogging. We continue to do it after, but it was bogging down the whole process. And we just wanted to cut, pull the Band-Aid off and just stop with the paper applications and focus our efforts on the online form. Because we've noticed that it's a faster process. People were getting their results much quicker. And so we just wanted to do that. So right now, no more paper manual applications. Just resubmit if you had not received your results.
Okay, so if you submitted an application after May 14th, and you have not received a determination, please resubmit into the electronic system, but be mindful, please, as Renee mentioned, that you are selecting your appropriate category of childcare program, so you don't submit an application into sort of the wrong track, and that will delay your approvals, right?
That's correct.
That's it.
That's correct.
Okay, thank you.
Thank you.
Because we're all in this together. Many EI group providers, they need to have a childcare permit. And so we want to make sure that we are being clear with the community in terms of what those expectations are. Any other questions for Renee before we move on? Okay.
Okay, thank you.
Thank you, Renee. Now we will have Shirley McLean, Director of the Outreach and Staff Development, present on outreach and community engagement.
I am having a little bit of trouble advancing the slides. 1 second, please. Please bear with me. Don't know what happened. All right. Okay, perfect. Phew.
Morning. Can everybody hear me through this mask? Yes. Okay, so I am going to share with you the Bureau's outreach activities for fiscal year 23. Sorry. So in fiscal year 23, the Bureau's goal was to increase equity and access to the early intervention program for all New York families, particularly Black and Latinx families. And we all know that outreach is very successful when presenting information to families. This is the key to retention and the increase in referrals. Next slide. So for fiscal year 23, we reached 10,280 individuals through these various outreach activities. Through external networking meetings, we reached 830 individuals. Through our presentations, which were either virtual or in person, and either provider or parent presentation, we reached 1,204 individuals. And through our health fairs, tabling, and detailing, and with detailings, we went to the salons, the grocery stores, the laundromats, even the parks. We reached 8,596 individuals. Next slide. So if we drill down a little bit deeper, we were actively involved with these community providers. With our community-based organizations, we reached 3,978 individuals. With our NYPD partners during the citywide baby showers and corrections, we participated in their wellness events. We reached 1,445 individuals. With H&H, we participated at their health events, reaching 1,278. And with our internal providers, meaning the neighborhood action centers, we reached 775 individuals. And with the faith-based outreach effort, we reached 724. And you can take a look at the other providers that we had actively engaged with. So the Bureau is also continuing its collaboration with United for Brownsville to increase referral and retention by focusing on engagement with families at every step of the process. And as we all realize, the successful role of the ambassador, the EI ambassador, as well as the implementation has led us to collaborate in a training. This training will focus on dispelling myths, the application of tools to facilitate engagement, the use of language to communicate EI at every process, and building self-awareness. This training will also have two key components. One will be a knowledge-based and a skill-based component. This training will be towards service coordinators. It will be a virtual training that is set to launch on February 6, 2024 on the Service Coordination Professional Development Institute platform. Next slide. And our key partnership highlights for fiscal year 24. We will continue to work with the Department of Youth and Community Development. Every year they have an annual event called Spring into Health, which takes place from April to May. We will continue with our NYPD partners to participate in the community-wide or citywide community baby showers. We are directly involved with the East Flatbush Community Partnership Annual Men's Health Appreciation Day, and that will be an annual event. We have a sustained presence at Kings County Hospital, Emergency Pediatrics. We actually table there bi-weekly. We also table at the Gotham Health Centers at Brownsville, East New York, and Crown Heights. We are working with the Brownsville Safety Alliance Initiative. They have an annual event that lasts for a week, and we're always participating in that event. And we are working with South Bronx Rising together to promote early intervention in order to support their families. We are also reaching out to the 17 CUNY Child and Family Centers and reconnecting with the Center for Interdependence of the Disabled throughout the 5 boroughs. Next slide. And finally, partner with us, partner. If you're interested in a presentation or you're interested in us participating at your event, please contact us at einow@health.nyc.gov, and have a nice weekend. Any questions?
Can you share that email again? Sorry, maybe in the chat. Oh, thank you.
We'd love to hear from you.
ACS is one of our sort of ongoing partners. I am actually really happy, and that Shirla's team has made such a concerted effort to engage the faith-based community in early intervention, and we understand that in many communities, sort of partnering with faith-based organizations is really how you dispel myths about disability and about participation in services such as the ones that we offer here. And further down, if we dispel a myth around early intervention, we're actually dispelling myths around special education, right? We know that it starts with us because we've heard families say so many times, EI, well, why do I want to start special education so early, right? So us doing that work is really wonderful. So I really thank Shirla for all of her effort.
Thank you. Thank you again.
All right. Liz?
Thank you, Shirla.
Thank you.
Now we will have Jeanette Gong, Director of Intervention Quality Initiatives, reporting on the EI provider professional development.
Good morning, everybody. Today I'll be providing an update about the EI provider professional development that the New York City Early Intervention Program provides as a resource for the field. Based on the ongoing feedback from providers and families, the Bureau of Early Intervention provides ongoing professional development and training opportunities through the BEI Hunter College Service Coordination Professional Development Institute, or SCPDI, and via our learning management system. Next slide. Based on feedback we received from a 2020 focus group study with Black parents, service coordinators, and SC supervisors, all 3 groups recommended more service coordination professional development for both SCs and their supervisors. The finding was echoed again with the recent 2023 SC survey, which we will be discussing in the context of the LEICC SC subcommittee report. The SCPDI was created as a partnership with Hunter College Silverman School of Social Work. Dr. Patricia Gay creates and performs trainings and administers the SCPDI. Dr. Gray also works closely with other expert presenters for each training. The themes of the trainings are based on what was recommended by the respondents of the 2020 focus group. These include culturally responsive service coordination, family-centered best practices, case management, engaging with and empowering EI families, reflective practices and supervision, advanced SC supervision, foster care, and natural environments, and the creation of functional outcomes. Since its inception in spring 2021, the SCPDI has held 5 synchronous remote series of trainings with 1,099 participants as of September 2023. In 2023, 9 trainings were being offered through the SCPDI. 6 trainings are completed, 3 trainings remain in 2023. Registration closes 1 week prior to each training, but there's still time for people to register. In fact, BEI emails providers about 2 weeks before each training as a reminder. As you review the slide, you will see the trainings cover many of the topics indicated in the SE survey data that we'll be discussing later in this meeting. So this is the link to the New York City Early Intervention Professional Development and Training webpage, where one may find the SCPDI registration flyer or find the other trainings that New York City Early Intervention provides. All of our professional development trainings are free. New York City BEI is an approved provider of contact hours, whether they're CEUs or CTLEs, for teachers, OTs, SLPs, audiologists, PTs, and social workers. Any of these trainings may be used to fulfill your annual requirement for professional development as per the New York State Department of Health BEI provider agreement. And it's also important to note that all of these New York City EIP trainings cover the New York State DOH BEI competency areas for the delivery of evidence-based evaluations and services. Some of you may have received an email yesterday from the state about their new dedicated webpage for these competency areas. The Professional Development and Training webpage also contains information about the New York BEI Learning Management System, or LMS. This platform provides 5 asynchronous remote trainings. These include implementing family-centered best practices, assistive technology, foundations of social-emotional development in infants and toddlers, appropriate evaluations for early intervention, and transition from the early intervention program. In fact, from spring 2019 to September 2023, 9,823 professionals have completed LMS training. This is just a snapshot of the different disciplines that taken the trainings. About 33% are teachers, 25% are other, which includes service coordinators, quality assurance managers, graduate students. About 15% are speech language pathologists, 10% are social workers, about 10% are occupational therapists, and 4% are physical therapists. We recommend that people do not wait until the end of December to register or complete the annual trainings. So here is the link again to the New York City Early Intervention Professional Development and Trainings webpage. If anyone has questions about SCPDI, you can email us at scpdi@health.nyc.gov. Or if you have questions about our learning management system or our other early intervention professional development, email us at embeddedcoaching@health.nyc.gov. Thank you. Do you have any questions?
Jeanette, I just wanted to thank you and Pat Gray and our partners at BEI, for the opportunity for ACS to participate in the training. I know our education team really loved participating and presenting, and especially engaging in very substantive conversation with the participants after the training. And we're very excited about how these trainings will help our agencies and collaborating to provide helpful services. So thank you again.
Thank you. Everyone was very excited about the training. There were a lot of great questions from participants. So we also appreciate this partnership as well. And we look forward to your presentation next year in the 2024 series. Okay, thank you very much. I'll speak to you guys later.
Thank you, Jeanette. Now we will have Catherine Canary, Medical Director, present on the EHREI project.
Hi, good morning. As you may know, we've been working on this project for well over 2 years now, but we haven't given you an update since the February 2023 LEICC. So just to refresh your memory, one of the goals of the Bureau of Early Intervention is to increase EI referrals and retention among historically underserved groups. This particular initiative allows for a hospital system's electronic medical record to refer a child to EI, and then with parental consent, to exchange information about that child's progress through the EI process. This mechanism is expected to increase awareness as well as equity and retention in the program and promote clear communication pathways between the program, referring healthcare providers, and families. We were awarded our initial grant from the Robin Hood Foundation in July of 2021. So this project has included 20 pediatric primary care sites across 4 hospital systems, 16 from Health and Hospitals, 1 each from Montefiore and NYU Langone, and 2 from One Brooklyn Health. So what's been our impact thus far over the past 2 years? All 20 clinical sites have institutionalized the electronic referral mechanism, and they're very interested in making this electronic referral widespread across their entire parent institution. So this might include referrals from like inpatient units, NICUs, or an audiology clinic if they have one. We have a smooth bidirectional communication mechanism with all 20 sites, and this allows their clinical team to follow up as needed with the family. A lot of this work is done by either their Healthy Steps team or a community health worker. We're in the midst of the evaluation phase now, and we expect to be able to produce a population-based assessment of the increase in EI referrals at 2 of our partner locations from FY20 through FY22. So now let's look at some data. There were 3,795 referrals using the EPIC EHR mechanism from January 2022 through June 2023, a space of 18 months, and 78% of these referrals included consent for bidirectional data exchange. EHR-EI refers a larger proportion of Black and Latinx children and children living in high and very high poverty neighborhoods as compared to citywide numbers. This slide shows the trend in total volume of EI referrals from FY19 through FY23, with each year stratified by referral source, either a community source, the parent, a healthcare provider other than one of our EHR-EI partners, and the partner sites. Referrals dropped from 35,000 to 29,000 between FY19 and FY20 during the COVID state of emergency, as Nora showed you earlier in the presentation. And then referrals increased to more than 34,000 in FY22. As she said, we think that some of the referrals made in FY22 were delayed and would have been made in 21 if the COVID emergency hadn't occurred. And this hypothesis is supported by the slight drop in referrals we saw in FY23. EHR-EI referrals represented 0.03% of all referrals in FY21, but had gone up to 3% in FY22 and up to 8% in FY23. So as a result, referrals from all types of medical providers represented 26% of all referrals in FY23, up from 23% the year before and 19% in FY21. Next. So this slide looks at retention, which, as you may recall, means making it through the process to a multidisciplinary evaluation. Overall, there were 1,532 EHR-EI referrals in FY22 that had completed the evaluation process by June 30th of 2023. The retention rate was 73%, which is 2 points and 3% higher than among referrals from other medical providers. This difference is masked by differences in population characteristics between the two groups and isn't statistically significant. But when you look at the race-specific data on the right-hand side of the slide, you can see a 3 to 5 point difference for Black and Latinx children, respectively. This slide shows the impact that the project has had on referrals and pretty clearly points us to our next steps in the project, which I'm going to talk about in the next slide. So just for reference, rate of referral is the number of referrals per 1,000 children birth to age 3. And here we're looking at these data by race, ethnicity. In FY19, which is at the left-hand side of the slide, the EI referral rate for Black children under 3 years of age was 86 per thousand. That's shown in the red line. This was a main driver of the EHREI project. And by comparison, the rates were 108, 110, and 117 for white, Asian, and Latinx children, respectively, that same year. In FY22, the EI referral rate for Asian children under 3 years of age was 96 per thousand, which is shown over on the far right in the purple line. By comparison, the rates were 102, 106, and 133 for Black, white, and Latinx children, respectively. The EI referral rate among Asian children had reached parity with rates among white children by FY19, but it then declined from FY19 to FY21 in response to the COVID-19 pandemic. But unlike the rate among white children, the rate among Asian children didn't rebound in FY22. Historically, Black children have had the lowest EI referral rates, but focused equity initiatives like this one, EHREI, have really mitigated the impact of the pandemic on EI referrals and have promoted increases in EI referral rates among Black and Latinx children during FY21 and FY22. So we have several things we'd like to do next. Given the data on referrals for Asian children that we just discussed, and with the fact that we still have a ways to go with getting the referrals of Black children to mirror the percentage of Black children in the city's birth to 3 population, we want to expand our focus in these communities in a couple of ways. One is we plan to continue the support at our current sites, but we also would like to increase to an additional site at One Brooklyn Health, which serves a predominantly Black population. And we'd also like to partner with an additional healthcare system, Medicis, that's located within a large Asian community in Queens. Also, the bidirectional information exchange, the way it currently functions, is really human labor intensive, and that's therefore makes it not sustainable. So we're looking to automate this component by applying electronic health information exchange technology and interoperability standards so that it would make providing EI information something like receiving a lab report or an X-ray report. We plan to continue to evaluate our impact and to share this project widely. As Lydia mentioned, we did present it at the SEICC a couple of weeks ago. And we're really happy to say that Robin Hood will continue its support of this project through 2025. The Viking Global Foundation is a new partner that will also be supporting this work, and we're hoping to bring on one additional philanthropic partner. Can I answer any questions?
Okay, seems like there's no questions.
Great, thank you.
Thank you. So we'll move on to Michael Bergen, who's director at the Speech Language Hearing Center at Brooklyn College, and Jacqueline Shannon, who's associate professor of early childhood, early intervention, and parenting at Brooklyn College. They will be presenting on building the early intervention workforce. Happy to see you guys.
Hey, thank you. It's great to be back to share an update. And it's been really fascinating and wonderful to hear all the incredible work that's happening around the city on behalf of children, both before and after, and all this integration and happening here. It's great, great job. So I'm going to, and my colleague Michael are going to provide an update on our work that we had shared in February. If you can go on to the next slide. So just to provide sort of an overview of today, our objectives, we're going to just provide a little background info, the goals of our work, the work that we have reviewed regarding professional national standards and requirements across our 4 key disciplines, the current reality of our work in the workforce, recommendations that we're providing to New York State Department of Health, and next steps and future opportunities. Next. So just to remind everyone, our research team is myself, Michael Bergen from the Communication Arts and Sciences Department, along with his colleague, Dr. Sharon Bowman, as well as Beth Alenko, who is a professor of OT at New York Institute of Technology, and then my colleague Karen McFadden, who's a professor also in the Early Childhood and Art Education Department at Brooklyn College. And I want to start off by just again thanking and acknowledging our funder, the New York City Early Childhood Research Network, which is a project of the New York City Early Childhood Professional Development Institute and CUNY. And their work, again, bridges research, policy, and practice for early childhood. And we want to, a special thank you to the Heising Simons Foundation, because they've been a funding partner that's really helped make this research that we've been doing the last 8 months happen. And a special acknowledgement to the Executive Director, Donna Anderson, her research associate, Erica Yardy, and her team, and also Lindsay Bravo, who is their new research director as well. Next. So the presenting issue that brought us to this work was the current New York State Ed Office of Higher Ed and the Office of Profession Regulations. Standard curricular in institutes of higher ed do not require students to learn about early interventions, core competencies, or to engage in clinical experiences with infants, toddlers, and their families. So as a result, there's lack of college level EI course content, and it's limited to no or very minimal anything related to EI in the birth to 3 years population. Further, internships and fieldwork experiences in home and community settings aren't typically occurring and are not required, or if they do, they often aren't counted towards internships requirements. Next. So our project goal was to really closely examine and research the New York State Institute of Higher Ed's requirements and regulations within the higher ed offices as well as the professional offices, in an effort to enhance the quality of the educational preparation of current and future early interventionists across 4 key disciplines that are authorized to provide EI in New York. So early childhood special educators, occupational therapists, physical therapists, and speech and language pathologists. And it's also an effort to address our shortage, New York State's shortage of early interventionists, including professionals from linguistically diverse backgrounds, and to build our EI workforce capacity across all 4 key disciplines above. So our expected impact based on our recommendations are to include the EI competencies and related experiences in credentialing requirements for New York State Ed Office of Higher Ed and Office of Professions will significantly increase the quantity and improve the quality of EI services. The pre-service college students in ECSE, OT, PT, and SLP will develop knowledge of EI competencies while gaining experiential learning in EI settings, resulting in increased fieldwork placement opportunities. We also expect that students will obtain clinical experiences working with infants, toddlers, and their families from culturally and linguistically diverse backgrounds, helping to further build a high-quality, diverse EI workforce. And just to remind everyone, so the 5 core competencies that have just recently been approved, and as Dr. Gong had reported, are now actually on the website for all to see really in a deep way. There is to really look at these. So we really spent a great deal of time kind of looking at these and sort of thinking about where is it missing within the regulations and how do we make these recommendations to integrate this important knowledge that early interventionists need to know right at the, right during their pre-service training, and then also looking at the fieldwork placements. So just to remind everyone, so what we had done to get to our recommendations, we closely reviewed the national standards and the state ed requirements. So within early childhood, we looked at DEC, NAEYC, and 0 to 3 standards. We looked at the Higher Ed Office of Teaching Initiative requirements, including the types and pathways of certification. So we went beyond just sort of the language of the regulations, but sort of thinking about how do people become certified in these areas, which included looking at extensions and annotations that exist. And also looking at the New York State Board of Regents Early Childhood Workforce Group, their blue ribbon recommendations. And within the allied health professions, OT, PT, and SLP, they too, we looked at the national certification standards and their NICEAD's licensure requirements and extensions. And then as well as we all looked at the telepractice across disciplines, both at the national standards and NICED. And then we all came together. So weekly we were meeting as groups. So we were looking at things individually, but really it was very much an interdisciplinary effort, collaborating, meeting on a regular basis, looking at what we were seeing and reviewing things together. Next. So just to give a little background info in terms of certification types, and these are just some examples. So just to become an educator, early childhood special educator, first you need an initial certificate, which is entry level, and you can get that at the bachelor's or master's level. And then there's the professional certificate, which you would get within 5 years of getting your initial. And you would need to be a lead teacher or lead in that role and obtain a master's degree. Then there are also cross-disciplinary and developmental age extensions that exist, such as an example is the bilingual extension certificate. And student and candidates take additional content in that area, depending on the specific age they're wanting to work with, to learn more about supporting linguistically diverse families, children. And then there's also the annotation as well, which is at this point, an example is one that's an extension to support children with severe or multiple disabilities. And this extension does not provide an additional certification, but it shows, it demonstrates a depth of knowledge of this content area. Next. Then the other thing in terms of specific pathways. So there's ways to go to become certified as an approved teacher provider, just through a program like Brooklyn College in our early childhood undergrads, early childhood special ed program, our grad program, and also obtaining an additional certificate. So one can get an early childhood and then also get additional special ed certification or maybe a different age. And then there's also the individual pathway. So depending on the needs in the state, those people can also then apply on their own and share their content and coursework that they've had in other colleges or out of state, et cetera, and get approved. And the same thing with additional classroom teaching. You can, if someone has a child certification, they can take a couple courses and then get certified in early childhood. Next. So within early childhood special ed, it's actually called this the general programs regulations for teaching students with disabilities in early childhood. So their regulations require a content core. So all students are required to have knowledge about liberal arts and science content, such as math or art. Then there's the pedagogical core, which is more of a broad pedagogy across the PK to 12. So there are certain expectations that all teachers, no matter what age they want to work with, have certain knowledge. And then there's a program specific core that is really for children birth to second grade and students with disabilities. And that's probably where the majority of the language recommendation changes occurred. And then there's also the requirements for field experiences, student teaching and practicum. Next. So within the early childhood special ed, the current reality. So one thing too, the New York State Department of Health early intervention competencies are in line in sync with the DEC and NAEYC recommendations in 0 to 3. There's very much overlap, which is probably not really surprising. However, when we look at the NICED, students with disabilities, so to get certified in early childhood special ed, the language, used student throughout, but child language is missing. The certification is birth to second, and it does include developmental processes, language acquisition, co-teaching, collaboration, family, culturally, linguistically diverse students. However, the emphasis, developmental emphasis, really pre-K to second. Some key EI competencies that are missing are culturally and linguistically responsive practices, family-centered, coaching, strength-based parent-child dyad, reflective practice. And then also within the field work of student teaching, their requirements begin at pre-K. Birth to 3 years specific requirements are missing. And again, there's workforce shortages in the birth to 3 area, both in childcare settings that we're seeing as well as in EI. Next, Michael is going to, I think, move on to the next step.
Yeah, and thank you,
Thanks,
Jacqueline.
everybody.
Hi again. I'm Michael Bergen, and thank you for inviting us back and for providing an opportunity to present this material. And so we have some slides that are, slides coming up that are similar to the format of the early childhood special ed slides that were presented by Professor Shannon. However, their content is focused on the EI service provision within the allied health professions of occupational therapy, physical therapy, and SLP, speech language pathology, areas that our team explored in great detail. My colleagues and I took a deep dive into the existing national accreditation and the certification standards and the New York State Ed licensure requirements for each of these professions, which are quite broad. And although these practice and accreditation standards are general and not age specific, there are elements embedded in curriculum which relate to aspects of the New York State DOH 5 competency areas for early interventionists. So for example, there are elements of typical and atypical development, elements of diversity, elements working with families and caregivers, and also of team collaboration. And we see that accredited academic OT programs prepare entry-level practitioners for general work across the lifespan. That experiences and content of birth to 3 populations are often limited or missing and are not specific, to those ages. And although there are guidelines, that bottom link there are guidelines that are set forth by the National Organization for EI Practice for OT. They are not mandates. And the last point on that slide is one, we have on subsequent slides as well, in that we're experiencing workforce shortages and provision of early intervention OT services. Next slide, please. And moving on to physical therapy, we similarly reviewed PT's accrediting body standards, and much like OT, they're non-specific to age, meaning they're across the lifespan, but they do have elements embedded in curriculum which relate to aspects of the 5 competency areas. As for PT's licensure within New York State, that's also within the Office of the Professions and has state guidelines for practice, which are consistent with PT's national standards for practice, again, throughout the lifespan. Sorry to sound like a broken record or CD or MP3 player. As for accredited PT programs, we can see that the same characteristic of required curricula, which is generalist across the lifespan, it's devoid of birth to 3 content and experiences, and both the national and the New York State CE, the continuing ed requirements, are general, do not specify content of any kind. We've provided here a link to a fact sheet of the National PT Organization, which recognizes skills that are needed to practice in EI. Again, they're not mandates. And as with OT, we're experiencing workforce shortages in physical therapy. Next slide, please. Okay, moving on to speech language pathology. It's ASHA, the American Speech Language Hearing Association, that sets national certification standards and has a semi-autonomous accrediting body that's known as CAA. It's the Council on Academic Accreditation. Both the certification standards and the academic accreditation standards are general, and they're throughout the lifespan in speech language pathology as well. As with OT and PT, we do see elements embedded in curriculum content and within the experiential learning requirements, which relate to aspects of the 5 competency areas for EI, although again, they're not age specific. The practice of SLP is defined in New York State Ed law documents within Office of the Professions as well, and those guidelines for practice are consistent with ASHA's national certification standards for practice throughout the lifespan. As for academic programs, we again see that the required curricula are generalist across the lifespan and missing birth to 3 content and experiences. And both the national and the New York State continuing ed requirements are general and don't specify content. And as with the other allied health professions, we're experiencing workforce shortages in SLP. Next slide, please. Our team has prepared some recommendations on this slide for early childhood special ed. We suggest considering inclusion of birth to 3 and early intervention content into the existing credentialing regulations. And we provide some specific suggestions here by infusing, as Dr. Shannon mentioned, the child language, incorporating the word child, by incorporating the 5 competencies within the teaching regulations for students with disabilities in early childhood, and by mandating birth to 3 experiences in these requirements for teaching students with disabilities in early childhood and in general early childhood education. Next slide, please. Okay. Our team also has recommendations for the allied professions of OT, PT, and SLP. And here we suggest some language which includes birth to 3 and which exceeds the entry-level practice requirements for the professions via proposed memoranda. This is a model which already exists in SLP with other specialty practice scenarios. And there are examples on this slide that are captioned in the web pages listed. And that second bullet there describes another possible direction to take by including birth to 3 language directly into the continuing ed requirements described in each of the allied health disciplines licensure regulations. Next slide, please. Thank you. While some recommendations are necessarily specific to the professions because of the nature of licensure differences, there are a number of recommendations our team has which are interdisciplinary. They cut across all of these professions. So firstly, our review suggests that all EI practitioners should be required to demonstrate knowledge and skills in the 5 competency areas for early interventionists. And additionally, our review of the evidence led us to recommend infusing the 5 competencies into all of the recommendations we have on a subsequent slide that we'll get to, and that we consider developing 1 or more pathways that we've identified in that upcoming slide, pathways that will provide opportunities to increase workforce capacity in EI. Next slide, please. Okay. And so our recommendations to develop the workforce includes the memoranda, which Professor Shannon mentioned. They're also known as Dear Colleague memos that are intended to clarify existing policy from New York State Department of Health to inform potential EI practitioners of requirements to become approved providers. We recommend consideration of an interdisciplinary extension in EI that might not be much different than existing extensions such as the bilingual extension that NYSID has. Professor Shannon earlier described the mechanism called an annotation, and we advise exploration of a possible pathway for an annotation in EI. And lastly, we recommend the development of individual pathways for specific EI competencies, including credit-bearing courses, continuing ed courses, and or Department of Health training modules. Next slide, please. So those recommendations that we're describing have the potential for New York State to recruit and retain a highly effective, culturally and linguistically diverse EI workforce. They will expand and diversify the EI workforce by leveraging the relatively large existing pool of those who are credentialed in EI, but I'm sorry, credentialed professionals who do not currently work in EI. Will provide fast-track educational opportunities, will increase experiential learning placements and expand the number of supervisors, which in turn will collectively create additional opportunities, and will increase the number of EI providers throughout communities, reducing shortages and decreasing the existing wait time for services. Next slide, please. And so for the future, we're currently finalizing a report which we expect to complete in the coming weeks. The report will include these recommendations and proposed language, and will also include telehealth recommendations and analysis of a survey that we distributed. And moving forward beyond the scope of this current project, we hope that the various presented pathways might be further assessed and prioritized. We'd like to see a review of general early childhood regs to support inclusive practice, and we suggest consideration of expanding recommendations to additional qualified EI disciplines such as social work. And so we have, next slide, please. We have 4 slides of references, so we can actually just skip through these for now, but they speak to our sources for a lot of the material, in addition to all the time that, Jacqueline described we put in. And so we do have a little bit of time for some questions if there are any.
I just want to say thank you for this. And I know that this is dense, right? It's a lot. And for many folks who are not like myself, I'm not an expert in credentialing or certification, though I am quickly becoming one at this point. It's become apparent to me that if structural change isn't made around the area of requirements, early intervention, while we are important, and in New York City, there's 8,500 therapists and teachers that are actively providing EI right now, ultimately, I think we'll lose the battle in terms of workforce capacity building because we are still a relatively small system. But given the importance of the services and the impact that they have on the lives of children and families, I really think that it's important for this kind of work to be highlighted and for all of us who are interested stakeholders, advocates, providers, government officials to really try to understand these things, because overall, what this presentation says is that there are no requirements to do EI. There are snippets here and there, and people do, and professors and providers and people who want to work in this space do a lot of work on their own to make sure that they're ready, right? But in terms of actually having a requirement, that doesn't really exist. All the requirements start after the age of 3, right? And so if our system doesn't sort of acknowledge that, and we don't see these modifications on a state level, workforce capacity issues will never be addressed fundamentally. And we're always going to be putting little Band-Aids here and there to, well, let's start and we have, the city of New York, we have many academic partnerships now because we have decided really to put our money where our mouth is and create partnerships and create incentives for folks such as yourselves to build EI specialties, to build specializations. But but from my perspective, that's not a systematic solution to the problem of a lack of credentialing requirements, right? And so I just wanted to sort of put a fine point on this presentation because I personally think that it's probably where we all need to go in the future in order to really address this issue systemically and in the long term. So I'm just gonna see if anybody on the LEICC has any questions for Michael or Jacqueline. But thank you so much for undertaking this. This is not an easy thing to do. And, I just want to show you a lot of appreciation and gratitude for doing this.
Thank you, Lydia. Thanks, everyone.
Are there any
Thank you,
questions?
everyone.
Okay. All right. Thank you very much.
Yeah,
So
thank
now
you, everyone. And Lydia, we too, we're learning more about the whole process as well. I mean, it really is. It's worth the effort. Our children deserve this, right?
From my perspective, I think a lot of your recommendations are not mutually exclusive. I think many of them, the vast majority of them, at least the ones that you're presenting here, can be very complementary to one another, and they could be considered as like, here's some short-term solutions and here are some longer-term solutions. I really like this is what I personally think, but I think it'll be important to see what state partners think about this. My personal perspective is having, an extension or having another kind of specialization that people can do across discipline in EI because those mechanisms already exist, might be sort of one of the ultimate recommendations. But I think, I certainly had no idea that individual pathways existed. I had, this was all really a great education for me. So thank you.
Yeah, no, that's great. And it's like once our students hear about it at college, then that's when the hook is in, right? I mean, all of us here, the 60 people are, right? There was a hook that brought us in and we need to just bring that hook in earlier again. Thank you.
Thanks.
All right. Thank you. So now we will move on to Jeanette Gong, Dr. Jeanette Gong and Tessa Pitogo, who will be providing our LEICC subcommittee report.
Good day, everyone. Today, Tessa Patigo, who is the Director of the New York City Early Intervention Service Provision at Achieve Beyond Provider Agency, and I will be presenting the results of the recent service coordination survey that was given this past summer. Tessa and I are also the co-chairs of the SC subcommittee for the LEICC. Now I'm going to hand this over to Tessa to start the presentation.
Thank you so much, Dr. Gong. So in this slide, this is the list of members that includes representatives from the 5 EI provider agencies, our academic partners, 2 former EI parents, and the BEI staff. I think it's important to highlight that we do have a parent in the member, so I really appreciated that we have that feedback from them. The New York City Bureau of Early Intervention, LEICC, convened with the SE subcommittee to create relevant resources and professional development to enhance the quality of New York City service coordination. The LEICC SC subcommittee also focuses on building SC workforce capacity in New York City. In June of 2023, just this summer, the committee asked NYC-based SCs and SC supervisor to complete a survey designed to learn more about the experience of the service coordinator and the service coordinator supervisors as well. The survey responses will influence how the subcommittee's work what we will do towards additional resources and professional development. In this slide, there were a total of 317 people that responded to the SC survey. 26% of them responded and identified as supervisors, and about 81% said they were ISC, and there were about 79% that said OSC. So since this question asked people to check all the roles that applied, this means that many SC perform multiple roles. For example, many are both ISC and OSC at the same time. And some are SCs that also perform SC supervision. When we ask them, what is your current employment status? 64% responded that they're per diem or independent consultants. And we have about 38% stated that they are salaried. A couple of the respondents shared that they were both salaried and per diem. Another question that we asked the service coordinators were, how many agencies do you work for? 90% stated that they work for 1 agency. 9% stated that they work for 2 agencies. And we do have some outliers. 1% work for 3 or more agencies. We also asked them, how many years have you been working as a service coordinator? 60% indicated that they had 4 or more years of experience. 34% had said 3 or less number of years of experience, and 6% responded that they had no experience. Another question that we asked is, how many years have you been working as an SC supervisor? 17% indicated that they have been a supervisor for 3 or less than, or 3 years or less for supervising experience, and 18% had 4 or more number of years of being a supervisor. And since we have some SCs that are also supervisors, there's 65% that answered this was not applicable. We also asked them, what community districts do you work with for your SC or as being a supervisor? We have 35% indicated that they are in Brooklyn, 28% indicated that they are in Queens, 18% in the Bronx, 16% in Manhattan, and 3% in Staten Island. The distribution of where the SC works reflects the proportion of where EI children lives across the 5 boroughs. This slide shows the types of trainings that the service coordinators have completed. We asked them, when you first became an SC, what topics were covered in the initial SC trainings? So it's not surprising to see that 97% have completed the state DOH introductory to service coordination training, since this training is mandatory. However, it is also great to see that the survey respondents have taken the professional development training from the SCPDI and also from the early intervention learning management system with NYC. We also asked them, in what areas of service coordination do you believe SCs need more information or support on? And we asked them to rank their responses. Below on the screen, you can see the top 10 ranked items that the service coordinator seeks additional support with. We have the writing quality SC notes and timely SC billing, working collaboratively with EIODs, therapists, families across EC system, resources for families in the community, such as food insecurity, housing, immigration help, medical or mental health. Initial service coordination, SC requirements and best practices. We have effective case management, ongoing SC requirements and best practices, the transition process, enhancing family engagement, SC effectively working with ACS and EI children in foster care, and setting professional boundaries with families and setting appropriate expectations.
So the New York City Early Intervention Text Messaging Program, Text to Families, has been helpful for EI families, especially during the pandemic, by sharing up-to-date information and resources. In fact, research shows that texting programs are a great way to get health information to the public, even better than emails. One way to support the work of service coordinators is to create a text messaging program for service coordinators and their supervisors. The texting program will alert SCs and their supervisors about updates, changes in policies and procedures, resources for service coordination and for families, available professional development opportunities, and about best practices. Therefore, we asked survey respondents to select a name for our new New York City Early Intervention Service Coordination texting program, and the winner is EI Info for SCs, with 37% of the vote. 24% voted for text to SCs, and 20% voted for SC Guidance Texting Program. Increasing workforce capacity is one of the SC committee's goals. Therefore, we asked people to let us know how they learned about service coordination. 46% learned about it from a friend or colleague. 29% learned from a job posting on Idealist, Indeed, or other job websites. 15% learned from a family member who worked in EI. And 50% listed in the other category that included reasons such as I had a child in EI, I worked in an agency, or I worked in family court. When asked, do you think it'd be helpful for a bachelor or associate program to highlight EI service coordination as a career path? 84% said yes, while 16% said no. We then asked, what are the different ways we can effectively promote service coordination as a career? 68% said coursework, an associate or bachelor level course. 65% said job fairs. 63% said panels with EI representatives, such as SCs and EI professionals. And under other, 10% mentioned career day, increased salary and benefits, career development services, an EI website highlighting SC positions, and media ads. But it's apparent to enhance workforce capacity, partnership with EI provider agencies and academic partnerships will be important. We also asked, if you work or have considered working for more than one agency, what are the reasons for doing so? 53% said additional income. 39% said this was not applicable, this question. 28% said it was access to benefits. 22% said it was increased access to remote or telehealth work. 16% said scheduling flexibility. And 15% said access to cases in preferred working locations. The next question we wanted to know is about SC supervision. How frequently do you and your SCs receive supervision on a regular basis? 32% said monthly. 30% said, it depends on what's happening with my cases. 21% shared that it was weekly. 13% said it was every other week. And 15% shared that it was none, unless I asked for a meeting. Oh, 5%, I'm sorry. So what are your preferred working arrangements? 60% said they prefer to work fully remote. 33% said they prefer to be hybrid. And 6% said they prefer to be fully in person. So what is the best way to enhance the quality of service coordination and supervision in New York City? These are the top 10 items ranked from the first one being the highest ranked. Centralized tracking system for therapist or teacher availability by zip code. Frequently updated resources for families. Greater service coordination preparation and training. Electronic case management system. Electronic SC billing system. Electronic calendar system for scheduling and reminders. A system for tracking SC caseloads. Greater opportunities for service coordinators to observe experienced SCs working with families. More preparation and training for supervisors. And identify competencies of effective service coordination. Another thing that came up was we wanted to know how we could retain our service coordinators. So there are times when service coordinators feel distress in their work. What kind of support do you think would be helpful to address those moments? So these are the top 10 ranked in order of preference. Support for emotional intensity or frustration related to cases. Backup assistance with cases. Support in documentation of casework. Assistance in prioritizing cases and tasks. Assistance with the collection of progress notes. Balance in the level of demand across cases. Balance in the timing of initial and ongoing IFSP meetings. Instruction and practice in using problem-solving skills. Assistance with monitoring cases. Ability to communicate with family and the EI team consistently using multiple methods agreed upon by the family. And timely supervision. So as you can see, many of these topics are really related to areas that supervision can cover. So what are our main takeaways from the survey? 1, there's recommendations for enhanced SC supervision in the following areas. Greater service coordination preparation that includes ongoing training on SC and EI best practices and regulations, coaching on SC documentation and billing, managing caseloads and support for complex cases, and how to work collaboratively with EIODs, interventionists, and other early childhood systems. Secondly, engaging and supporting parents that includes info on the latest community resources to support families, setting appropriate expectation and boundaries with caregivers, and defining the roles that everyone plays, and understanding the impact of culture and diversity on communication and building trusting relationships. Also, we want to focus on building service coordination workforce capacity. We have to work with academic partners to develop coursework in bachelor or associate level programs, formalize pathways and introduce early intervention earlier than graduate school, and recruit students as service coordinators from colleges that can later go on to graduate school. In regards to job fairs, academic programs and EI providers will need to partner to create job fairs for students, and these job fairs should include panels with EI representatives comprised of service coordinators and other EI professionals to discuss the type of work they're doing and address questions and answers. So what are the next steps for the New York City LEICC SC subcommittee? We're going to work on initial service coordination training that will be created to complement the content of the current mandatory New York State DOH BI Introduction to Service Coordination Training. The training will be given as part of the Service Coordination Professional Development Institute series, and eventually will be one of the trainings in our New York City BEI Learning Management System. We're also going to be working on EI info for SC's text messaging program updates related to New York City and New York State DOH early intervention, resources for both families and for SCs. We're going to include SC and EIP best practices and provide alerts about professional development opportunities. And we want to work on building New York City EI workforce capacity. We're going to work with academic partners to create pathways for students to have careers in EI and service coordination, and job fairs with EI providers to recruit those students from colleges. That's the results from the SC survey. Are there any questions from the LEICC?
So I just want to say thank you, and Tessa, it was lovely meeting you. Thank you for all the work that you did to co-chair the SC subcommittee, and these are excellent recommendations and very actionable, and I think that the department is going to be moving forward on a number of them. So we very much look forward to more curriculum, to an SC texting program, and further engaging with our academic partners to, we've really been thinking about workforce capacity and development from a perspective starting at the graduate level, right? More therapists, more teachers, and all that. But for service coordination, it's sort of a different problem, and it requires a different solution because the staff is different, right? You don't need a master's. You can have an associate's with appropriate experience, or you can have a BA, right? And so that actually opens up a very different world of possibilities in terms of building that kind of workforce capacity. So thank you for all the work that you all did in putting together this survey. I think it's yielded some very interesting and very significant recommendations for us, probably moving forward for the next 3 years. So a lot of work to do.
Yes, thank you so much. And it's a pleasure to be with the committee.
Thank you.
Thank you. So now we will have a public comment. Were there any public comments submitted?
No public comments were submitted for this LEICC.
Okay. So we will adjourn this meeting, and I want to say, as a parent, I want to thank everyone who presented and shown that, we want to put forward early intervention as something that is accessible to everyone. I know for me, I didn't even know about it when my child went in, and so putting EI out there is very important so that everyone knows that this is work that's really important for our children to get to the next level in life. So thank you very much for all that you have done, and I hope you have a very good weekend. Thank you.
Thank you, everyone. Thank you, LEICC members. See you soon.
Bye-bye.